Hey, in this video, I'm going to give you my honest physical therapist review of Voltaren for arthritis pain. Voltaren is a cream or a gel, it's kind of both, that has an active ingredient called Diclofenac. And Diclofenac is marketed for use with arthritis pain. My name is Dr. David Midoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. We make helpful videos with advice, tips, exercises, and stretches for a variety of body problems, and you can find them over in our playlists in our channel. Please consider subscribing to our channel so that you don't miss out on any of the helpful videos we post every single week. So let's answer some of the most common questions that we get about Voltaren and Diclofenac as an option to treat arthritis pain from our patients and our viewers here on our channel. The number one question we get is, what is Diclofenac? And related to that, people will ask, is it natural? Is it safe? And to answer that question, Diclofenac is a chemical substance created in a pharmaceutical lab by chemists and pharmacists. So it's not a natural substance. It is a medication. And if you purchase Voltaren, which you can purchase it for yourself if you like, we've got a link in the description below so that you can find it on Amazon. But if you purchase it, you can see that it comes with labels like this, just like a normal medication would, and it's got warnings and side effects and all that kind of stuff that you need to watch out for, which it's pretty low in side effects and likelihood that it's going to injure you, but you still have to watch out, and they got to be safe about letting their customers know as well. And some people want to know what's the research behind Diclofenac as a use for an anti-inflammatory medication. And what we know about it is that it's a non-steroidal anti-inflammatory drug, which is from the same family as ibuprofen and naproxen. So it's known to be a powerful pain reliever, and Diclofenac specifically is known to be more effective when used to the skin versus ibuprofen or naproxen. You can dig up on the internet tons of research articles, scientific research studies about Diclofenac and how it's been used in a variety of different ways anywhere on the internet. I linked an article for you in the description below in case you want to go find that article, where they reviewed a bunch of other research studies that included a total of 3,000 people in its use for topical pain relief, specifically for arthritis. You can find that in the description below. And what they found, just to give you the quick summary, is that it is effective according to the research study. They found specifically that it helped people with pain, mobility, and functional capacity, which means your ability to do many things sustained over a period of time. So if you're dealing with an arthritis problem, you definitely want to be able to have reduced pain, more mobility, and be able to be on your feet for longer periods of time and be more active. Now, another common question that we get is, what are the side effects of Voltaren and Diclofenac for arthritis? The number one side effect is going to be skin irritation, and it says that on the label here. But we know based on the research that it's safer to use versus other NSAID, non-steroidal anti-inflammatory drugs, and it's definitely safer to use than non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, naproxen, and of course Diclofenac when taken by mouth. So those, when you take them by mouth, they put you at a much higher risk for having stomach bleeding and intestinal bleeding. But Diclofenac rubbed on your skin like you would with Voltaren is definitely much lower risk for having those kinds of side effects. Now I'm going to read you some of the other side effects that are here on the box. They talk about possible liver damage, stomach bleeding, of course, and a heart attack and stroke warning. So if you're over 60 years old or you have a risk of having a heart attack or stroke, then you just want to check with your doctor before taking Voltaren. So if you're over 60 years old or you're at risk for having a stroke or a heart attack, then you do want to check with your doctor before using Voltaren. Now let's talk about how to use this stuff. So I'm going to open the box for you here, and just to show you what this looks like, I opened it already, of course, and it comes in a little tube that looks like this. It says Voltaren on it, and it's got the same instructions on the back. Now this does have a safety lock on it that I've already broken. It's a safety seal. It came with a little seal right on the top, and what you do is on the cap, on the other end of the cap right here, it has like a key that you lock the little star-shaped lock, and then you twist it off, and it's still embedded in there. It's still stuck in there. I don't think you need to get it out. Oh, there it is. It's a little star-shaped plastic piece that was stuck on there. So I'm going to throw that away. And then what the instructions say, and it comes with more instructions on the inside of the box here. It comes with a dosage card, so you can tell this is a little more intense of a over-the-counter pain medication that you can use. And it's kind of this transparent card, and you don't have to see the details, it's really small, but basically what this yellow orangish bar says is it says to use 2 1/4 inch long string of cream or gel, whatever this is. I'll just do that for you. So that's about 1 inch, and here's about 2 1/4 inch. So that's how much you would use for something on your upper body, and then it says to use double that, 4 1/2 inches for something on your lower body. So I'm going to wipe this off here in a second. I'm not going to rub this into my skin. I don't have any pain, thankfully, but it's kind of water-based. You can see that it glistens there. It's kind of a gel and a cream. I don't know which one of the two I want to settle on. I would just say it's a little bit of both. Some other important notes from the instructions are not to use this more than 4 times per day. It also says that you may need to use it up to 7 days to begin to see the effects of it. And it does give you a limit of using it for 21 days or 3 weeks. And don't go any further than that without permission from your doctor, is what the instructions say. And one more important note is don't use it on more than 2 body parts at a time. Remember, this is a medication, and so you can technically overdose on it, so you want to be careful to follow the instructions. It's not a natural substance. This is a synthetic chemical developed in a pharmaceutical lab, so you want to follow the instructions and not overdo it. It's not a natural substance. Now, to give you my honest physical therapist opinion, I would go for a more natural substance first, a more natural cream, like a menthol-based cream, an oil-based cream. Those are going to be more natural products out there that may not have as many side effects as Diclofenac would have. And before going to Diclofenac or Voltaren, you might even use a lidocaine-based cream or spray. There's also roll-ons for these because that's a safer drug to use, or a safer product to use, than Diclofenac. That being said, Diclofenac is not the most riskiest pain medication you can take. But if you're trying to stay as natural as possible, you want to try that stuff first. And the other thing to note with this is only going to give you short-term pain relief. If you're dealing with arthritis, whether it's knee arthritis, arthritis in your back, in your neck, shoulders, feet, hands, anywhere like that, this is not going to solve the root problem, and it's not going to give you long-term relief. That's another common question that I get is, if I put Voltaren on my joints, will it fix the arthritis? And the answer to that is absolutely not. It's only going to give you short-term pain relief, which is beneficial if you're having trouble sleeping at night, if your arthritis is keeping you from walking or moving around or getting through your day, then you might use this in the short term. But be looking for some long-term solution that might help you out, like the correct exercise, the correct mobility, which we talk a lot about on other videos here on our channel. I hope this video was helpful for you. If you thought it was helpful, please give us a thumbs up. Consider sharing this with a friend that needs to learn about this stuff. And please go check out our playlists here on our channel for more long-term solutions to help you out with your arthritis problem. Thanks so much, and we'll see you in the next video, friends. Bye-bye.